are comparing, and if it is associated with outcomes, it is going to lead to bias. So there is differential loss to follow up. It is different in the two comparison groups, and the reasons for loss to follow up are associated with exposure and outcome. If these criteria are met, there is going to be selection bias. Now, this is an example for attrition. Now you are again comparing COVID-19 outcomes. Now you are comparing it between migrants and non-migrants. Now, migrants who fall ill are going to go to their native place. They are the ones who are going to be lost to follow-up, right? And these are the persons might be who are going to have severe outcomes, complications, deaths, and these are the people you are going to miss from your study. So you are going to not be able to ascertain these events in the migrants. There will be biased results, and might be you will get your outcomes which are more favorable in terms of the healthy migrants who have stayed back in your sample. So this kind of study could lead to differential follow-up, more loss to follow-up in the migrants, that too those who are migrants and who have more untoward outcomes. That is, the loss to follow-up is associated with both exposure and outcome. This is a scenario which is prone to selection bias. So what to do to prevent selection bias is, one is you should always report in a cohort or intervention study what was the proportion of people you were able to follow up. So what all you did to ensure that there was satisfactory follow-up. Then if there is attrition, there will be loss to follow-up in a cohort study or intervention study. You have to make an attempt to find out what were the reasons for attrition, whether it was migration or refusal of the participants, or there were administrative lapses, or there were health status changes, that is people lost their memory or became or reached a status where they could no longer actively participate in yours. What were the reasons that there was loss to follow up? This is important. I'll tell you why. Another thing you can do is you can compare the baseline characteristics of those who were lost to follow up and those who were retained, right? And if there is this loss to follow up is very less, and you can show that there were no significant differences between those who small number who were lost to follow up and those who have been retained in your study, you can drop the observations who have been lost to follow up, and you can have an analytic data sets for whom the entire data is available, and you can safely do analysis in that analytic data sets, given the fact that it's very small percentage who are lost to follow up and there are no baseline differences between those who are missing or those who are lost to follow up and those who have been retained in your study. And then this is what I'm going to tell you. This is going to be a bit heavy, but I'll do this only after confirming that you are comfortable and we can move ahead with this kind of analysis. So in loss to follow up, basically you do not have the outcome data with you in cohort studies. So before I move forward, are you with me till now?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So what actually we have seen is we have tried to see, we began with what? We began with understanding the difference between random error and systematic error. Then we said that when we want to get to the truth, we have to consider effect modification, confounding, random error, and bias. Biases of two types, the selection bias and information bias. And we then focused on the selection bias. And in the selection bias, we saw that how selection bias can creep in a descriptive study. Then we saw how selection bias can creep in analytical study, beginning with case control study. We focused on how biases can occur when we want to recruit cases. Then how biases can occur when we want to recruit controls. Then we saw in cohort studies how if we have problems in the comparison groups, there can be biases. And then in the intervention, we saw how the allotment, if it is not done properly, and if randomization is not practiced, there can be selection bias. And now what we have seen is there can be attrition or loss to follow up in cohort study and intervention studies, which can also result in biases. And now for this loss to follow up, what we are going to see is this last sentence, that is, if there is loss to follow up, are there any analytical remedies or analytical techniques to handle? Because what will happen, one choice I gave was that, okay, you have loss to follow up, just drop those observations and stick to a new data set in which you have complete data. Can anyone tell me what is the problem with this kind of an approach?
Time consuming resources, ma'am.
Right? Okay. What else? Mainly, see, you are going to lose on the power, right? You have calculated a sample size and you want to stick to that sample size to get adequate power. If you just drop down on the observations, you are going to reduce your sample size and reduce the power of the study to identify a true difference if it is there. Agree?
Yes, ma'am.
Okay. Um, I think I'm not going to keep my promise actually, because I'm going to go ahead after 1 hour. Are you all okay with it?
Yes, ma'am.
So because I plan to just complete the selection bias.
Yes, ma'am.
Yeah. Joyce, is there anything in the chat box?
No, ma'am.
Okay. So now the scenario is that there is loss to follow up. You do not know the outcome data. Now what to do? You are worried that there is some substantial loss to follow up and you do not want to drop or miss out on all of that data. So there are a few things you can do. First thing is to check whether this missing data which is there with you is missing at random or missing not at random, right? So you have missing data and you have missing individuals and you have this outcome which you do not know, but you have all the baseline variables which you know. Now, this missing at random means the probability of being missing or missing depends upon these other variables which are there. But this probability of missing is not associated with the outcome. So your, the review of literature and your sense of your study variables should give you confidence that whatever missing individuals are there, the missing status is not associated with the outcome. So the migrants, for example, in the migrant study are lost to follow up. They have some characteristics like they are older males, they have severe symptoms, and they are lost to follow up. But if you are, for example, the outcome you're looking at is mortality, you know that this missing status is not related to mortality. If you have that confidence, then you say it is missing at random. Are you getting me?
Ma'am, can you
Can you
explain
please
again, ma'am?
please repeat it?
See, you have individuals who are missing in your follow. Missing means they are lost to
Yes,
follow up. Okay. So those individuals are lost to follow up. You cannot know their outcome. Baseline variables you have calculated might be in follow up to some point. You have followed them up and collected their data, but not up to the measurement of the outcome. So supposing the outcome is death, it is COVID-19 and it's migrants we are interested in. So migrant and no migrant, that is your exposure status, and outcome is say death because of COVID-19. But some of the individuals you have lost to follow up. Some of them are migrants, some of them are non-migrants, right? But you do not want to drop all those who have gone missing or have been lost to follow up. So what are the options is what I'm going to tell you. So you have to ask yourself, there are some baseline variables. These may be different for those who are lost to follow up, and these may be also associated with death. For example, we know from literature that older individuals are more prone to death. Those who have severe symptoms may be more prone to death. So these variables, they are associated with outcome, and these are also risk factors for the for an individual to be lost to follow up. But you feel that being lost to follow up is actually, it's not associated in any way with death. You're getting me?
Ma'am, so that you were saying like if they are old people, they are prone to death. If their data is missing, we don't want to like it is missing at random.
No, this data, the age of the patient, the baseline symptoms, this data we have with us.
Yes,
Okay.
ma'am.
Now these
Ah,
individuals have been lost to follow up. We don't know their outcome, whether they have died or whether they are alive, because they have been
yes,
lost to
ma'am.
follow up. Okay.
Yes, ma'am.
Now, if we know that their status of loss to follow up, that is not in any way associated with death, with the outcome. That is
Okay,
when
okay,
you
ma'am. Okay.
say
Um,
whatever is missing at random. On the other hand, I think you'll understand if I contrast it with missing not at random.
okay, ma'am.
What does this mean? This means that the probability of missing, it depends upon the outcome itself. That is, your literature is telling you and your gut feeling is telling you that whether a person is lost to follow up or not, that affects the risk of death. That is, those who are lost to follow up are more likely to die. If that is your gut feeling, then it means this scenario is missing not at random. Are you getting me?
Yes, ma'am. I got it, ma'am.
Yes, ma'am.
So,
Yeah, Ajit.
so it is like that the patients are like older patients. They are more prone to get death, like die. So if we are having those people in the study, they and we are missing it, it comes under missing not at random.
So what you have to ask is this loss to follow up which is happening. Is
Is
this loss
associated
to
with
follow
outcome.
up some way
Uh,
related to your outcome? That is,
yes, ma'am. Yes.
people who are either going to get or not going to get the outcome based upon this status of loss to follow up.
Yes, ma'am. Got it.
So
Thank you.
migrants who develop most severe symptoms leave the city and they are going to die. They are more likely to die, those who who have been lost to follow up. It means your loss to follow up is associated with the outcome. You feel it is associated with the outcome, so your data is missing not at random. The missing data is missing not at random. Even after adjusting for age, baseline symptoms, everything else, you feel that this person who has lost to follow up, there is more likelihood that that person has died compared to a person who is not lost to follow up. If you feel that is what is happening in your study, then it is missing not at random. And if you feel that no, whether the person has been lost to follow up or not, the likelihood of death is going to be the same in either of the cases, then it is missing at random. So this is a bit difficult. This is what I'm saying is a bit heavy, but you have to read about this concept to get more clarity. I'm just introducing the concept here. If you are asked a question on missing data or loss to follow up, these are a few concepts which you can discuss. So if now in the previous slide, I told you that you should know the reasons for attrition. Now, to decide whether it is missing at random or missing not at random, these reasons help you to decide which of these two is happening. So, if it is because of migration per se, or people have refused, or it's your fault, there is some administrative problem because of which people have been lost to follow up, or changes in the health status which is resulting in loss to follow up, so the reasons for loss to follow up actually help you to come up with your assumptions. Whether your assumption is missing at random, what is missing at random, or what is missing not at random. Because once you make that assumption, then you decide on the method to handle the missing data. Are you getting me here? I understand
Yes, ma'am.
that
Yes,
this
ma'am.
is a bit difficult. I understand that, but just trying to introduce this concept because I was also always apprehensive of these concepts. So I'm just trying to. What do you are you comfortable with this? Because then I'm going to tell you a little bit more about these methods.
Ma'am, is there any way to be sure that this is going to be like to differentiate between these two, ma'am, or it's just the researchers'
Yeah, it's the
verdict?
researchers' assumptions.
Okay,
Yes.
okay.
Anyone else has any questions? Because I'm sure it's not going to be clear in one go. I'm just introducing the concept. I am requesting you to go back and read about these concepts. Can I move ahead?
Yes, ma'am.
Yes,
So
ma'am.
what we are saying is that there is loss to follow up. You should not just say loss to follow up. You should first tell what is the proportion of your sample who have been lost to follow up, right? Then you should also be in a position to say the reasons for loss to follow up, because there are a variety of reasons for loss to follow up. When you look at the reasons for loss to follow up, you should be then able to assume whether what is missing because of loss to follow up is missing at random, or whether it is missing not at random. That is, this loss to follow up, whether it is or it is not associated with the outcomes, with the different outcomes which are there. This kind of a thought will help you to differentiate between the two. Okay.
Yes.
If you feel that it is deterioration in the health condition which is leading to loss to follow up, and this deterioration will invariably lead to death, then you will say, okay, then I feel that my missingness is not at random. If it is some administrative reasons because of which some of them have been lost to follow up, then you can safely say it is administrative reasons. I don't feel then this loss to follow up is in any way going to be affecting the outcome. So my missingness is at random. Does this make it a bit clear?
Yes, ma'am.
Yes, ma'am.
Okay. So now let us see these methods. Now, if you have the missingness at random, there are two methods which you can use. One is the weighting method and another is the imputation method. And if you are assuming missingness is not at random, then what you look at is sensitivity analysis. So let us look at this. So the inverse probability of censoring weights, this is to be done when there is missingness at random. All you have to do is you have to weight the individuals who remain under the follow-up, and you want them to represent those who are lost to follow-up. So you assign weights 1 divided by probability of being observed in that group. For example, if you have migrants and non-migrants as your comparison group, 50% of the migrants are lost to follow-up. You divide 1 divided by 0.5, so you have 2. So it means 2 migrants who are in the sample are going to represent each migrant who has been lost to follow up. On the other hand, there is 95% follow up in the non migrants. So you use this formula and you get a weight of 1.05. So 1 is going to represent 1.05 individuals. So if an individual, because of loss to follow up, is there, their weights are going to be larger if there is higher proportion who have been lost to follow up. So this weighted analysis means you want to upgrade or upweight the representation of those who have been lost to follow up. And this can happen only when there is missingness at random. So all you have to do is use the weights in your analysis. Are you getting me here?
Yes, ma'am.
Okay. I know this is a bit tough. Then again, missingness at random, another option is imputation. Now, what happens here? You have again participants who are lost to follow up, but you have some baseline data and might be some data at some points in follow up. So you catch hold of that observed data and you predict the outcome based on the patterns of the data which you have at hand. And you do this by using a statistical model, which are known as imputation models. So the empty cells, especially for the outcome, you can fill in the missing data by using statistical models based on the data for the variables at baseline and a few data, whatever is there at follow-up time is there with you. Are you getting this concept?
Yes, ma'am.
Anybody else who is understanding what I'm saying?
Ma'am,
Yes,
in the
ma'am.
previous method, like
Hmm.
for the inverse probability, so what do we do there for the baseline characteristics of the individuals who are missing?
Yeah, no. Those baseline characteristics are there. These weights which are there, you are going to use in your analysis. This I'll tell you in some other class. You just calculate the weights, and in your entire analysis, you have to use these weights. That is, you have to give sufficient, value to people who have been lost to follow up, assuming that whatever is missing is at random. So those who are in your sample, who have been there with you till the entire follow-up period, they are going to contribute data, and you are going to use these weights which you have calculated in your further analysis. You don't do anything here with your baseline characteristics. Those are there.
Okay, ma'am.
So baseline characteristics of individuals who are there, no, they are still there. But in your further regression analysis and other analysis, you are going to use these weights for your outcomes.
Okay, ma'am.
So you are understanding the imputation part. That is, you have some baseline characteristics. Supposing we have only baseline characteristics, you use these baseline characteristics, to predict the outcome. Baseline characteristics of individuals who have been lost to follow up, not lost to follow up, right? So there are going to be some common things. So based on the outcomes of those for whom you know the characteristics, you predict the outcomes for whom you don't know the outcome, because their baseline characteristics are similar. It is something like that. So with
Yes,
this
ma'am.
example, I think you'll come to know. So the thing is, you don't just use one model, you come up with multiple such statistical models and complete data sets, and then you pool the results. So minimum of what is known as 20 imputations you have to do for missing data, and then you pool the results, the average of these, the outcome of the 20 results, and the standard errors or the variable variance which is there is calculated using these rules. So just remember that you have to pool the results from 20 statistical imputation cycles or models to come up with the outcome variable for those who are lost to follow up. Now let us look at an example. I hope it makes things easier. So you have, supposing in your follow-up, 30 lost migrants. Now you have some baseline data, right? It could be the age, gender, residence, socioeconomic status, many things you feel will are associated with missingness, as well as these are also associated with the outcome, say death. So you know that these are predictors, good predictors of the outcome based on other studies. So you use those variables, right? And you try to get the outcome status for those who have been lost to follow up. That is what I mean by creating complete data sets. That is what I mean by imputing the outcome or the deaths for those who have been lost to follow up based on baseline values. Are you getting me here?
Yes, ma'am.
Yes, ma'am.
So you are going to get 20 different probabilities of death for these 30 migrants, and then I calculate a pool result, an average and the variance, and I complete my data set using that average. So I repeat the process across at least 20 cycles. I get an average estimate with the variance or the uncertainty added to it, and I can use the entire data set without dropping any observations using what are known as imputations. There are single imputations also. Single imputations means what? One thing could be you take the average of everyone and apply it to all these 30 individuals. Or another thing is, when you are doing follow up, the last time there was a follow up, carry forward the status of that person forward. It could be not true for death, but for some other outcome. So there are multiple or different ways of doing this imputation, but the safest is multiple imputation, not just remaining depending upon one single statistical model, doing it repeatedly and taking an average, and using some statistical tools to look at the variance. Are you all getting me here?
Ma'am, one doubt, ma'am.
Yes.
Single imputation means we will take the average of
No,
those who are
single
having the
imputation
debt.
means only one imputation cycle, only one statistical model. Whatever one value you get, you say that is true for all migrants. In multiple
Uh,
imputation, you do the cycles again and again, minimum 20 cycles, and you take the average of the values you get in these 20 cycles.
okay, ma'am, thank you.
So again, my request is, I am introducing the concept. Please go back and read. Agree?
Yes, ma'am.
Yes, ma'am.
Yeah.
Yes, ma'am.
So if you are looking at loss to follow up, if you're looking at missing data, these are a few techniques which you need to consider. The next one is sensitivity analysis. Now, when the missingness is not at random, it means that your missingness itself is associated with the outcome. So very sick migrants leave, they are lost to follow up, and you feel that this is going to increase the probability of death. So your missingness is associated with the outcome. That is the time you do this sensitivity analysis. This is what? This is very simple. You consider the best case and the worst case scenario. That is, you assume that all the migrants have survived and do your analysis, and you assume that all the migrants have died and you do your analysis. Sometimes in between also you can do some adjustments. So you can say, you can take a series of values and see how your assumptions um, regarding the different outcomes for those who are lost to follow up affects your estimates, and report all of these values transparently. So this helps you to demonstrate that, see, I have taken all of these values irrespective of what I have done. My estimates remain more or less the same. So they are robust. So you can show your robustness by doing sensitivity analysis. But if the values change, then it could hint at bias. There is an issue, and there is a bias in your study. If you are lower the mortality rate, this is a simple mortality, but when you're looking at effect estimates also, you can make such assumptions, and the best and the worst scenario are the bounds which you can report. If both of them lie in on one side of the null value, it is a robust finding. That is, whatever assumptions I am making, still there is an association, so it is a true association. Are you getting me here?
Yes, ma'am.
So this is to be done where you feel that your loss to follow up is some way going to be associated with the outcome. So these three concepts, I know they are newer concepts, but please read them up and try and understand and use them in your analysis. So attrition bias, you have to aim for at least more than 80% of follow-up. And for that, you have to really do active follow-up by contacting the participants from time to time, having healthcare workers to visit them, and different ways in which you can reach out to them from time to time. If there is attrition, find out the reasons, because I told you it helps you to understand what type of missingness is there and how to handle this missingness in your analysis. Another thing is to compare the baseline of those who have been lost and those who have been retained. And if you feel that this proportion is very small and there is no difference, then you can drop observations and have an analytic data set of complete data and move ahead. I think that is known as missingness completely at random, or there is some other terminology for this where you can safely drop your observations. And then, of course, depending